Hi, I'm Dr. Santanu Bag. I'm one of the pediatric consultants at R N Tagore Hospital, Kolkata. Yes, we are often getting the phone calls from the parents that their child has got mild fever and cough or other symptoms, and we are seeing that many of them, if we test and they come, the test reports are coming back as positive for COVID infection. So, I mean, as I told you earlier that most of these infections are very minor infections like any other viral infections, and they need to stay at home and take adequate fluids and medicines for fever like paracetamol, and most of them will get better. Some of them might develop diarrhea or vomiting, and they need ORS or other medications for that. So it's important to keep them separated. Now often we are asked questions whether they need to be tested. Now, although it might be difficult to test all the children with mild fever, but I would recommend that someone who is having fever for more than 2-3 days, they should get tested, because there are other implications. Because if the test report come back as positive, then it is important to also take care of the older family members, okay, because they are more at risk of having severe infection. So yes, so if they have fever, persisting fever more than few days, they should be tested, and most of the illness can be measured at home with paracetamol, extra fluid and monitoring. Now certainly there are some symptoms when you should be worried about, and at that time you need to take the hospitals. But otherwise you can also try to get some advice online, because many hospitals like ours at R N Tagore Hospital, we are running online consultation clinics, and so we can assess from the history and how the child is doing, and if it appears that the child is otherwise well and healthy, they can stay at home. But yes, of course, if there are other worries like persisting fever for 4-5 days, and especially a high degree fever, the child is not eating, drinking off, or if the child is unwell with breathlessness and they look unwell, very lethargic, yeah, they need to come to the hospital and you need to bring them. And the other thing, as I mentioned already about the risk of having infections from two other members of the family, I again repeat that most of the time the children actually get infection from the adult members, but again the young children and even especially the adolescents, they can actually spread the infections quite effectively. So if there is someone in the family who are older, then you need to take care of them and keep the children who are infected in a separate room or in isolation if possible. This cannot be possible sometimes for very younger children, in case they need their mother. So in that case probably it's not possible, then we'll have to be practical, and definitely the parents need to take care of them. But yes, for other children, older children, you try to separate them and maintain strict hygiene, as I already mentioned.